Hi everybody, Dr. Mark Beaty. Today I wanted to talk with you a little bit about facelift and facelift techniques. Facelifts are very powerful procedures that can help rejuvenate particularly the lower face and neck, but also the midface and the area around the eyes. There are a lot of different named facelifts that you may see when doing research on the procedure, and I want to focus on three that are of particular importance. First, let's talk about a limited incision facelift. What does that mean? Well, that means any sort of a lift that is performed through incisions that are shorter and limited to only partially the area around the ear, with or without entering the neck. And in cases where patients have early facial aging, this can be all that's necessary to get to the supportive tissue of the face and tighten the areas that need to be tightened. This can be done with endoscopic assistance or without, and is popular amongst our younger patients. The second thing I want to talk about is ProLift, which is a technique that I first described about 15 years ago. And the idea with ProLift is that it's a flexible technique that allows adjustment of the incision length and placement, as well as the exact choice of how you elevate the supportive tissues of the face to be deferred until the time of surgery. So I'm actually making those decisions during the operation, and what that means is that I can ensure that we make the necessary changes to get the corrections that we would like, but without doing any extra work or incurring any extra incisions. And finally, let's talk about the deep plane facelift. This is the most comprehensive and complete procedure that we perform for facial and neck rejuvenation. And the key elements to a deep plane facelift are, number one, that relatively rapidly you transition from working just under the skin to under the deep supportive tissues of the face. And so you're moving everything as a single unit. The second really important thing about a deep plane facelift is that you are releasing all of the retaining ligaments of the midface and the lower face. The reason that's important is it means we're not pulling against any fixed points. We can move the whole area of the lower face and neck to its desired position under no tension and in a more vertical vector, which is the direction that your face changes as you age. Things tend to descend downward, so we want to lift them upward. So if you're looking for the most powerful and long-lasting type of facelift to achieve your rejuvenation goals, a deep plane facelift is generally the right direction to go.